spare spaces, we will have to work really hard as part of this session because we have a lot of speakers, and you know that the plenary session, which will start right after us, will not wait for us. So we need to finish on time. So, good morning, dear colleagues, of another Moscow Urban Forum. So it's the second day of our forum, and every session attracts attention of many people who are focused on development of agglomeration. And as part of our today's session, which will be dedicated to treatment and prevention, or I would like to say from treatment to prevention, health of citizens as a focus of city management. We see so how many people are here. That means that the topic is really acute. I am David Melik Gusseinov. I'm head of the Institute of Organization of Healthcare and Medical Management attached to the Department of the Healthcare of the City of Moscow. I will be the moderator, and I would like to introduce our esteemed guests. Anna Popova, Head of Federal Service on Protection of Consumers' Rights and Human Well-being. The Chief State Sanitary Doctor of the Russian Federation. Anton Kolobachevsky, Head of Department of Mineral Resources and Environmental Protection. Alexei Kuhn, Minister of the Government of Moscow. Mazda Adli, our foreign guest, a psychiatrist, the PhD in medicine, the chief doctor at Flieder Clinic Berlin. Cecilia Anderson, manager on programs for developing public spaces or UN Habitat. Carlos Dora, the coordinator for public health, environment and social factors in World Health Organization, and Vlada Saifedinova, medical director of the Fund of International Medical Cluster Foundation. So let's begin. And I will not try to abuse your time by any sort of analytical or trend-related discussions, because every speaker has something to share. You all have your presentations, and I would like to first hand it over to Anna Popova with a question. What's necessary to shape healthy space in modern cities? Because cities develop rapidly, and how can we improve city management in order to provide health, safety, and population well-being in a mega city? Okay, thank you very much. Allow me to greet all the audience. I'm really happy we have that many participants, and thanks to the organizers for focusing on this topic. It's for the first time when healthcare and prevention and space are discussed on the Urban Forum, how important they are for population health. And I would like to ask you, David, do I have 15 minutes? So how many? Well, at least 15 minutes, right? Okay, then could you please put the next slide on? I hope you can all see it well. Okay, I can do it myself. Just to see where we are. And obviously you all know that back in the times of Jesus Christ, our population of our planet meant 150 to 300 million people. And today we have nearly 8 billion which travel across the world very rapidly. And they live not like many generations before us. So we changed the mode of life, and we need to adapt requirements to our habitat, to our today's mode of living. So the forecasts say that by 2030 we'll have 43 mega cities, many of them in developing regions, and by that time Moscow will become an agglomeration with a population of at least 30 or maybe even 50 million people. We are talking about that, and we must be ready for that. Yes, of course. We have we talked about infection and diseases, so it's going down. However, it's not quite the case. I would like to show you that from 1970 to 2015, we see some threatening dynamics, not only in Russia alone, so higher death rate from tumors and from cardiac and blood circulating diseases. So the specific feature of today's world and epidemiological risks, we have a number of factors which influence. So development of trade and commercial relations, intensive migration, climate change, which influences our epidemiological risks, urbanizations, and availability of biotechnologies. And obviously, although we said about the ability to regulate biological and epidemiological risks, the number of accidents related with the risks for the entire planet is growing. You see this on the slide, and we need to get prepared for that. We need to get prepared for this in our decisions. So as for today, we are stakeholders in the process for changing the paradigm for healthcare. Given that a huge number of population from smaller settlements, from smaller towns move, and they spend all the time in bigger cities, and I'm talking about agglomerations, we have new risks. For instance, to illustrate epidemiological risks, if before like 150, 200 people ago, a person would contact at least 1,000 persons through his lifetime. But today, when you spend an hour in Moscow metro lobby, you will have 6,000 contacts. So for measles, we talked that the contacts were in 2 doors, but now it's 40 floors with a common ventilation system, and we should be ready for that type of risks. So the new development in the urban environment development, urban health concepts. So you see the goals and the tools they offer. So when the idea of urban forum, the idea of correct literate development of the city started to shape as an idea related to providing health in the city. And I believe that our today's motto, that every solution in a big city should be focused on population development, whatever decision should allow us a good progress in towards the main goal. So we are building for the people. We do everything for the people who live here to be healthy. So every solution made in the city should be focused on health of people. So urban health concept is close to us. It allows us to understand what's going on in the world. So outcomes of the last year's forum. So the Rospotrebnadzor hosted a research on a number of big cities. So experience of London, New York, Seoul, Singapore, and Toronto was studied. In terms of experience of organization of commercial regulation, different researches, monitoring, and whatever. What it was possible to get from colleagues from the satellite, we analyzed all the data. So the overview of the world practice, we got as part of these conceptions: monitoring and tools used. So it's about monitoring and data, research and educational center, and standards for design and construction. Standards which are based, according to our foreign colleagues, are based on protection and preserving health of the population. So in all cities which work with this vision, so this program and vision of urban development offers life laboratories, programs for development. Yes, so a number of examples you can see in our presentations. And of course, we see how it can be adapted to the Russian Federation. So we have the Rosnadzor, which for many years monitors, which is focused on that even before it has been a service, before we started to build a system of hygiene in the cities, and colleagues who come, and they come from a satellite city, because they said you have no interdepartmental variety. So, because in your case, for agreements you need 1.5 years. In our case, it's much less. So this has to do with competences Rostechnadzor, Rospotrebnadzor has. Yes, but this is what was created by experts outside of Rospotrebnadzor. So the first thing we saw on our host site is monitoring. So we have the monitoring and information foundation, which gathers data and collects data on water contamination, on soil contamination, radiation security. It also includes social factor, and we make a certain conclusion on that basis. So the results for 2017. And you see what changes happened. Well, of course, our main goal is first of all to provide for safety and well-being of a person. 2 years ago, a couple of dozens years ago, we got a special tool to assess efficiently of the comprehensive activities in the country in order to prevent this or that damage to health and safety of a person. So this data is being collected, and this is what we can do. What we do with the feedback, with the estimates we get today? Okay, yesterday it was like a reactive, response-based model with small data, and there was no proactive content. But today it's big data and individualized mode. And tomorrow, this would be the forecast proactive model, artificial intelligence, big real data. Because to make a management solution, every country, and Russia is not lagging behind here, you need to analyze big data. And we have the tools for that, and we are doing that now in order to develop management solutions. So how is it created with the development of a healthy habitat? So stages or fragments we would like to offer you for discussion. In my opinion, so they deserve a more careful attention. So a city should become a tool for prevention and improving the health quality. So in a city which is developing with the speed of Moscow, it's absolutely real. So we need to support programs of systematic support. It's a separate topic. We talk about life and health quality. We need common definitions, and we also need upgrade and modernization of our construction industry. So what do we plan to do? So we plan what we already have in place, and we offer the following solutions. So life quality assessment should be improved, and we should assess health of population differently. We need to select best solution, which would focus on saving health and lives, not only on supporting economic or technical points. Well, and of course, Moscow is a flagship city in developing a new urban environment. So I would like you to know that colleagues which are outside of Rospotrebnadzor system, once they saw them, they came to Moscow, and they say that the contribution of those who create Moscow today to health of the population, okay, like my street, you have tile instead of asphalt. You have more lighting. You have a lot of elements which are underestimated in terms of their contribution, in terms of maintaining and fostering health of Muscovites. And later on, I believe we need to move on. We need to calculate every solution on how it develops area we are talking about in terms of population health. Of course, Moscow is a forum for international interaction, and our arrangement with the government of Moscow was that today in the country to create agglomeration, yes, Moscow is a flagship, a leading city, but we have a lot of other cities with high population and high population density. But we don't have any subject we saw or we borrowed from other country. We don't have any team related to, well, I would probably put it differently, in making solutions on how to shape big cities. Focused on how to promote and foster population's health. And this is what Moscow is already demonstrating. We would like to offer to host an international forum on urban health. And we will get some support from the Russian Federation's government. We would like to host it in Moscow to attract key professionals. Many of them are really interested about our experience, so they really ready for a dialogue. We need a discussion on what we see and how, and develop common approaches and gather people in the country who used to do it. It should be a pool of experts, of specialists, which are able to carry out these goals. So that's why we are talking that apart from this event, this very important event, we need another point of development. We need some sort of scientific or research or institution or community. We need to provide them with a forum in order to have a constant discussion and development. And Moscow is involved in that. We need to teach our doctors on how to build it correctly. And we need the doctors to teach construction people, architects, how to build and design in these areas to support population's health. And this would be a big push forward. We have huge airport hubs where with a single water supply, which supplies water to tens of millions of people. The overall system of waste removal, of ensuring atmospheric air security, on how the noise level can be reduced. Yes, because this is a huge program. It's not possible to say that Moscow is a quiet city, but you need to plan to ensure life is comfortable in the city. Yes, of course, these aspects are really, really important. And it's important for the colleagues who were to Indian cities, how chaotic development and construction lead to barriers on medical health. The logistics shelf becomes very long, and if there is a person with an infection, so when we need to reach this person as soon as possible. Our colleagues from New Delhi say that the transportation logistics is such that we are late when we have an urgent patient. So Moscow could avoid this strategy. Moscow is building differently. It has a lot of new developments, and we were proud to assess them.
So these are the leadership results of Moscow, which should be analyzed. There are a lot of important things, and monitoring is part of us. It's clear that we need to find new directions. We're trying to change the format of monitoring to monitor big data, to have new approaches to analytics. All this should be done very quickly. We need to discuss the development of the city environment from the point of view of healthcare. For that, we need to have a research center in Moscow which could accumulate all the research. And also, we need to have some educational institution, either a university or a department. This is the most important conclusion of our work. Thank you very much for your very subtle presentation. So 78,000 prevented deaths is a great figure for me. But you highlighted epidemiologic and somatic risks. But big cities very often face risks of mental impairments of citizens. I'd like to give the floor to Mazda Ali, a psychiatrist, the author of the book Stress in the City, Psychiatric, PhD. So Mazda, do you think it is enough in big agglomerations, not only in Moscow, internationally? Do you think the issue of negative impact of stress, or urbanistic stress, and its impact to the mental status of people living in megapolises, do you think? So the floor is yours.
Thanks very much for inviting me to this fantastic discussion. I'm impressed to see the fantastic job that Moscow is doing health-wise, and I absolutely agree that it's taking over a flagship role with regard to focusing on urban health as a matter of urban planning. Yet, and however, as a psychiatrist and a stress researcher, I would absolutely say that mental health is a little bit still on the blind spot in every city of the world, and there is a lot of sensitivity and an increasing sensitivity in the megacities around the globe for health, but not so much on mental health. And on the same time, we know from epidemiological studies that urban dwellers are at increased risk for suffering from stress-related psychiatric disorders. The risk for schizophrenia, for example, is twice as high for people living in cities. The risk for depression is increased by 1.5-fold. The risk for anxiety disorders is increased. And these are diseases which are very much related to social stress occurring in cities, so that as a consequence, thinking of prevention all measures that help us to decrease the amount of social stress that an urban population is exposed to should be absolute key. For example, by providing adequate public space, which increases the social cohesion in a city, or at least in parts of a city.
Понятно. Спасибо большое. Аплодисменты.
Thank you very much. Please welcome Master. Mental health is of paramount importance for medical care and also for prevention of stress and other mental stress. I would like to give the floor to Cecil Anderson, Manager for Public Space Development, UNDP project. Cecil, in your articles, very often you relate the issues of the importance of social spaces development in cities like Moscow, London, New York, and their positive impact on people. So how do you think this social places should be, the public spaces, to be useful and to be healthy? How do you think this kind of public spaces should look, right, to be healthy?
It was a very nice segue coming in from public space. I'm taking a very different angle, which is really looking at public space as a lever to reducing non-communicable diseases. And what we're promoting at UN Habitat is that a certain amount of area within the city, in the built-up area, should be allocated to public space. So we're talking about streets as public space. We're talking about open public spaces, which are green spaces, gardens, courtyards, and we're also talking about public facilities. And I think that's absolutely important to have this network of public space. And I think this is the importance, is the network. Because we can talk about an amount of land that is allocated to public space. It can be a large green park in an area, but it's actually the networks and that it is evenly distributed within the city so that everybody has access to that. We're also talking about public space as one of the levers for local governments to be able to take action with regards to creating a more healthy environment for the citizens. For example, you can look at things like, I think lighting was mentioned earlier. You can talk about how the spaces are designed, how you can create that space where people can meet to interact with each other, to also have that possibility for recreation, for children's development. It's extremely important as well to have spaces for recreation, and just to have that opportunity to move around in a city. As UN Habitat, we promote the compact city, the connected city. Compact meaning that it's not that far to travel, because you actually find that in many cities, in the US, for example, with urban sprawl, that a lot of people are spending time commuting in their vehicles, which adds up to about a week, a year. Instead, that could be used to actually have leisure time with your family, to have different kinds of activities out in the open space. So this is actually the importance of having that compact city with better connectivity, promoting walking and cycling, and creating that quality of life, because you brought that up earlier, how important it is with the quality of life. And with that, I think my two key messages coming out from this is that it's very important to take into consideration public space, how it is designed, how it is protected, because we're seeing that public space is being reduced in cities, that more and more areas are becoming commercialized and taken up in a commercial or in gated communities, but to keep those public spaces open and accessible for all. And that's the important thing, accessible for all. My other key message that I'd like to bring up is that we need to also have that coordinated effort, which I think was also mentioned before. We need to make sure that local governments, the different departments in local government actually are brought together and to think about health perspective of public space. You can talk about the department that works on sports and recreation, the department that works on social welfare, the department that works on urban planning, the department that works on transport planning, and also actually the legislative arm of the local government. And I think this is something that we very seldom see, is that interdepartmental committee that can actually take these issues forward. Thank you.
Thank you very much. Аплодисменты, Сесилия. Вам действительно вопросы принятия управленческих решений, они...
Thank you very much, Cecil. You are right. Political will is significant. And I would like to give the floor to Carlos Dora, coordinator of the IHE Department of the Public Health Environment, Social Determinant of Health, the World Health Organization. Carlos, for you, health impact assessment is significant. So the question is, how this approach is applicable in big cities when decisions by government are taken? So the floor is yours.
I apologize for the slides, but I thought it might be better to have some visuals. First of all, to say how warmly I feel of Anna Popova's speech in the vision that she has to really incorporate that function in health systems, which is to connect health to urban planning decisions. I think that's crucial. There's research needed, there's training needed, but I think an health impact assessment is part of the tools to get there. And I strongly believe, and you show some of the work which is being done by the WHO, which is actually to make a very clear connection in qualitative terms and in quantitative terms, using the science base, how much we know about the links between specific urban policies and public health, and to make use of that to create scenario analysis. That's what we've been doing. We've been, so I say we, I should clarify that I retired from WHO recently. I'm now a professor in Columbia University, but I'm still collaborating with WHO, and the work which is being presented here is the work done in WHO that I was leading there. In what we call an urban health initiative. So very quickly, this is a blood vessel, and this blood vessel has a clot, has a thickened wall, and that causes strokes and heart disease, and other diseases, dementia, for example. And this feature of the blood vessels is very closely linked to the diet people eat, to physical exercise they do, into air pollution. So the point that I want to make is that the blood and the body is very closely linked to the public policies that create air pollution and enable physical activity or create healthy diets. So there's a number of those connections between public policies and health. I won't, that's too extensive to cover here, but transportation, you have, for example, physical activity, injuries, noise, which are linked to the transportation system you have. And the evidence in WHO shows that some transportation systems like cycling, walking, and public transport access to them are good for health. And there's good scientific evidence for that. Similar to housing and ventilation, temperature inside the home are very linked to air quality, food, access to green areas. There's lots of good evidence for mental health improvements into people to have access to green areas and to public spaces. And also, so the vision that we have is one that links the diseases, non-communicable diseases especially, to the kinds of risks to health, and we have lots of science in that, but then we're referring it back to where are the policies in the city, transportation, housing, waste management, land use planning, access to common space, and how is it that those connections are made? So the way we make that connection is through health impact assessment tools. It's very similar to environment and social assessment tools in terms of the procedure, so I won't go into the detail. But just to give you an example, again, in transport, for the connection, we look at what are the objectives of transport, what are the objectives of health, and where do they connect? And that's how we build the evidence base. This is a quick run through the Urban Health Initiative, where the way we're operating is we start with mapping the urban policies, transport, waste, housing, and who are the stakeholders, looking at what are the opportunities for public health from those specific policies. And then we train health professionals to do the kind of analysis, develop or make available the tools to do those analyses, some of quantitative, some of qualitative, including health impact assessment and economic analysis. And then we create scenarios. If the city decides to go in this direction, what is it that you can expect in terms of health benefits? If the city goes in another direction, how much you can expect to gain? So you can, in advance, anticipate what are some of the potential benefits. Then we communicate those results to the different stakeholders. And we link up, which include government, civil society, universities, etc. And then we establish a system to track progress in the policy implementation, in the risks to health, and in the health outcomes. So we think it's a good tool to use in the context of, for example, Anna Popova's vision for what, not only to demonstrate what Moscow has achieved in view of its great improvements in urban areas, but also in terms of looking for other cities, for example, how much they will be investing, what performance they will be getting in terms of health outcomes. So I thank you for the opportunity. It's a pleasure to be here with you.
Thank you very much. Аплодисменты Карлосу Доре.
Thank you very much, Carlos. Thank you for such a subtle presentation. Having listened to it, I realized that the majority of observations are being fulfilled in Moscow. Thus, I would like to give the floor to Anton Kulbaychevsky, responsible for the Department for Environmental Management and Protection, Moscow City. Anton, in your interviews and articles, you've said a lot that ECHO monitoring project has been launched by the Moscow City Department together with experts. Could you please dwell on it? Because this topic really has much to do with what Carlos has shared with us. Thank you very much. I'm so happy to be here. I'm so happy that you have found your time to visit Urban Forum 2018. So I'd like to mention that environment is one of the vital non-medical facts which impacts the human health. That is why the program for environment as it is never exists. But we have a lot of events. And all of them are part of the overall healthcare program. That is why we always work together with our colleagues. And our target is to reduce, the amount of the worst elements in the air. So you can see our progress in reduction PM10 and PM2.5. These are very harmful particles, and many mega cities have been combating with them for a long time. And I can highlight that a lot has been done within the recent 7 years. When we started our program, our major target was to monitor and to calculate the impact of the environment to the human health. And not only when people are static, but when they move from one area, one district to another one. Monitoring the data, we need to get the data regularly. every 20 minutes from every station, from every device, we have data important to carry out assessment. So you can see in this slide that we monitor air concerning most harmful elements. We subdivide them into two groups having bad impact on cancer, malignant diseases or non-malignant diseases. And all the data is in line with the data with the World Health Organization. All the services which need this data get them real time. Roskomnadzor of Moscow is among those institutions, and we've been working with this institution in collaboration for a long time. We also plan to have a new target indicator, the decrease of unhealthy impact. So we have methods for risk assessment, which is now a good instrument for operating and managing the city. And we also have this data transparent for our citizens. And this is how we're going on to work. On this slide, you can see all our elements of our policy. Number one is climate. So let's compare the hot summer of the year 2010. It was really very hot air, and the air also was polluted. People couldn't breathe. So it was a bilateral impact from some factories, right, but also from the heat itself. How to prevent this kind of risk? Greening is a good solution because it takes the load, it regulates the climate, and we attach our importance so much to this very factor. You know, I can speak a lot about that, but I've got to be in line with the agenda. But probably all of you know that Moscow is one of the greenest mega cities in the world. Many cities which are no longer green spend a lot of effort and funds to restore and to plant new forests, new plants. So we are lucky to have a good legacy, which is forests and woods, which are natural, probably for healthier, more efficient than artificial ones.
Yes. Also, population health and contribution into economic infrastructure is among the only feasible expenditures, because when we do adaptation in other areas, it's not efficient. But it is efficient when we talk about health and greenery. So together with the healthcare department, all our events, all our activities are targeted on how to adapt the urban environment to the risks. And also interacting with Moscow office of the World Health Organizations, we plan to take part in regions for the health contest. So the project is focused on how we can reduce non-medical risks. Thank you so very much, and I would like to thank you all for participating in our forum. Thank you, Alexey Ivanovich. So, an important input from you. We would like to hear it because you represent the entire structure in the capital's in the capital's infrastructure. Yeah, so in one of your interviews you mentioned creating ecosystem for a patient. So all systems of the capital's healthcare should be focused on the patient, so including logistics. But what did you mean by this ecosystem? Good afternoon, dear colleagues. Half an hour ago, at a similar discussion next door, dedicated on development of the Moscow medical cluster, our Lithuanian colleague paid attention to the fact that targeting digitalization and development of new technologies, we shouldn't miss our patient. We shouldn't miss the human being, because this is our top priority, and we can hardly neglect it. And we should also take into the account that the work of healthcare systems all over the world is reflectory. Of course, leading a healthy lifestyle and understanding that your own health is not your own legacy, but on that it is something future of your family depends on. So the possibility for a healthy person to come to an outpatient or any other institution, it is available. However, in most cases we respond to a person, and we will be much healthier if our society will create a healthcare system which would focus on patient. So we should offer all the resources to the patient, like logistics, human resources, technologies, and so on. For instance, today in Moscow parks, there is a massive activity focused. So doctors are invited there to offer consultations, to check the most basic parameters, and it's a very popular activity. So why should we do it? You have a lot of outpatient clinics, 46 units and 200 buildings. You have prevention departments, so where a healthy Muscovite or a person who considers himself or herself to be healthy can check the basic parameters. And last year, 500,000 people were involved in actions like this, like 500,000, which is 5 times more than in 2016. Another action which demonstrates our the intention of the government of Moscow and that of the doctors to go to patients. So this is like the cancer screening, which is carried out in outpatient clinics on Saturdays, which is a day off. So to check transplantogenic content. So in similar March, 16,000 people came to them, and we could catch this oncological diagnosis at the very first stage. Why did we create the uniform medical system, which is called like EMIAS? Today it unites all outpatient public institutions in Moscow, 450 buildings and 86 legal entities. Not just to control and to manage healthcare in the megacity. It's not possible to do without numbers. But in order to create for a specific Muscovite the possibility to apply for a visit to a doctor. So for the physicians, therapists, you can use remote channels, internet, just to have an appointment online. In all outpatient clinics in Moscow, you have like a physician the most qualified person who has 3 times less patients than a general practitioner, but he is responsible for them because he is in a verbal communication with them and also uses other channels. So in prospect, this system will allow us to monitor condition of all Muscovites. And today, over 10 million people are registered in MES database. So the system is actively developing. And in the nearest future, our electronic card will be integrated as a resource available for Moscow outpatient clinics. It will be integrated with 40 major hospitals, which account for most of the resources of the Moscow region. Also, work with the ambulance, rehabilitation, cancer treatment, stroke treatment. So for everyone in Moscow to see a person as he is, to help him. So another example of how the approach focused on patient is applied. We have 30,000 medical professionals working on ambulances. They are continuously moving. Most of the crews use GPS system to be closer to the patient, using analytics from the ambulance. So a call to a Moscow ambulance center, so in 5 to 7 seconds you will get an answer, and then the dispatcher will see the closest ambulance car, which in spite of known problems with the traffic will arrive very quickly. And also this principle focused on patient could be used with the acute disease. So when with the cardiac disease, a patient will be quickly delivered to the closest hospital. Is the system open for residents who are not registered in Moscow? The answer is yes. So according to the Constitution of Russia, every citizen of the Russian Federation can select the healthcare institution and the doctor. So the system is focused on the citizen of the Russian Federation, and it's very quickly to Moscow, the capital of health. Just type these words in any search engine, and the patient will get the right for follow-up, including high-end medical aid. So, David, this is what we mean by medical ecosystem and the system focused on patients. Thank you, Alexey Ivanovich. We are about to begin our questions and answers session, but before that, I would like to ask a question to Volada Saifedinova. So she's a medical director of the Foundation of International Medical Clusters. So our session is called From Treatment to Prevention. What's the contribution of the foundation and the cluster in terms of prevention? And what could be the contribution in changing the paradigm from treatment to prevention? Vlada, the floor is yours. Thank you. I would like to greet delegates to the Moscow Urban Forum and my colleagues, my friends, and most of my friends are doctors. So we all live in conditions of a dynamically developing city, the wonderful city of Moscow, and we understand that in this dynamically developing city, the human capital is the critical thing. So that's why the state and the business should be concerned on how to preserve health of our existing population. However, aging process is characteristic for people in Russia and in other countries, and we need to be active in senior age. So, but what do you do to preserve your health in dynamic megacities? So the principles of medicines of the future, the 4P of the medicine or preventive medicine. So it's rather a medical philosophy when the focus is on individual condition of every patient. What's the way the patient feels and how we can help the patient? And the attention of the doctor is on the very early response to cells, to functional changes. The doctor assesses what are the risks for development of certain diseases, and based on big data array, the doctor prescribes preventive activities to preserve health of the patients. And there are two approaches: special purpose programs, when at the public and private healthcare level, systems are developed to analyze data for big groups of people, focusing on their professions, on their age, on how the patients are adapted to the environment. And the second approach is about individual programs for any particular patient. And the focus should be made on the lifestyle, on the behavioral features. And it's important to give recommendations to every person based on his nutrition, based on his physical activity, because what's good for one person could be harmful for another one. At the same time, healthcare is becoming more and more of an accurate research. So it correlates with mathematics, with computer science, and it's very often that we now use medicine of the proof. And if before these principles were used in the systems where the result was easily measurable or comparable, for example, the efficiency of medicine-based therapy, but at the moment, principles of Ministry of Evidence are being actively used in prevention. And the healthcare system says we checked this or that program and we see how useful it can be. And that's why we can recommend it to any particular person, any particular patient. So, and today, as part of the cluster, we see the closer integration between medicine and IT technologies. IT technologies become a driver for medicine development because they allow us to make smart solutions, to manage resources, to store big data, to exchange information, as we heard in the presentations by other speakers. But at the same time, I came across an interesting fact. So there is an idea that in 2040 we will develop a computer which will address big data, which will be much smarter than us. So it will get information from the cloud, and in the most challenging situations, the computer will make better decisions than a doctor. However, a doctor has his clinical thinking, but all these developments could be really helpful for our healthcare. And also, the last thing to mention is that we need to develop conditions to get patients involved into healthy lifestyles. It's no secret that the actual condition of a human depends on medicine. 20 accounts for his genetics, 20 for his environment, and 50% is his lifestyle. And it's not accidental, it's not occasional that there are serious trends for developing healthy lifestyle. And the urban culture contributes to that too much when you have sports grounds and bike lanes. But it's important that in the big cities of today, we need to move to health literacy. So a patient should be informed, should be literate about where to get these or that services and how the state will help him to solve problems with the solutions. So the 4P medicine is about involvement and partnership between the patients and the doctor. Then the patient really becomes responsible for his health, and he makes a decision on how he will be operated. He knows all his risks, his recovery potential, and this creates a comfortable environment for comfortable recovery and interaction with the doctor. Thank you, Vlada. Applause. At the moment, we will begin question and answer session. But before we begin, please pay some attention to the screen. I would like to play a video.
And more are moving to cities. By 2030, 6 out of 10 of us will live in an urban environment, and a quarter of us will be over 60. As we witness the greatest migration in human history, cities must deal with a unique set of public health challenges. Diseases, health emergencies, air pollution, access to water and sanitation, poor diet, and physical inactivity. Urban planning can profoundly affect the ability of residents to live long and healthy lives. It's estimated that cycling just 1 hour per day can save as much as $600 per year in healthcare costs. Today, people have unprecedented access to their own health data, so focus on the individual is also key. As is preventative care and timely diagnostics, the use of smart technology and artificial intelligence, and the implementation of a value-based healthcare model that's based on the principle of maximizing the cost-to-benefit ratio of a treatment. Cities' economies are also changing as the elderly pay less taxes but need social support and healthcare. A healthy population is essential for the prosperity of nations, and cities are increasingly leading the way in tackling global development issues such as climate change and public health. So what can be done to ensure tomorrow's urban healthcare is efficient, cost-effective, and inclusive?
Спасибо. Так и называется наш.
Thank you very much. This is our session called From Treatment to Prevention. Now there is an opportunity of asking some questions. We don't have much time, so please speak into the microphone. Who's responsible for the microphone? Oh, great. Could you please introduce yourself? Professor Danilov, Sechenov University. Good afternoon. It's so nice to see how the city environment changes, but it's famous and it's known that 90% of time our citizens spend indoors. So the target of our government is to construct a lot of blocks of flats. The standards are so that to avoid trouble, but not to comfort, have you got any ideas how we can test the same parameters indoors? Maybe there are some regulations or possible regulatory initiatives for that. Thank you very much, Professor. You're absolutely right. Besides the environment, we have the environment which is located indoors, and it is called hygiene of the houses, of the housing. It becomes more and more important, which is proved by various experts. They say that every day 50 to 100,000 elements are specified and synthesized now. All of them are used for different materials, for different chemicals. The standards of today for safety and security are quite tough. We humans haven't changed physically. Still, the dosage has become more important, and this dosage should be regulated by standards as well. This is what our colleagues specify. Our requirements and standards are higher and tougher than those in other cities in the world. So you're right, all this should be the element for assessment of risk factors for the human health. This topic should be discussed further, and would like to discuss it during the forum in December, Urban Health Forum. Let this topic be part of it. So we are located and we live in the cities, and it is not always that we spend our time outdoors, but we are indoors. Very often we are in transport, in cars, in trains, and indoors. It is also important to be healthy. It is important what we breathe in, what we eat. All this should be standardized. I don't think there is enough survey in this country and internationally concerning the elements, concerning the air we breathe in indoors, at home, in public places, in transport. This needs to be assessed more thoroughly. Chemical aspect is important, but physical aspect is not less important. 24 hours a day, we have ways about it. We have devices. We have those physical waves which surround us. And I think our scientific and research institutes should study this fact further. Thank you very much for your question once again. Well, green standards have become crucial for Moscow government. Already we study all the standards in England. Certainly, designers of the Moscow city complex try to imply these standards, constructing schools, kindergartens, outpatients, clinics. All these standards will be implemented and are implemented as part of the renovation project. Green Office is our project where we assess offices of different companies in accordance with 15 priority criteria, and I kindly invite your institute to take part in this research. December will conclude our survey, and there will be awards as well. So believe me, very soon all offices in Moscow will be green, and all schools, etc., will be green as well. Are there any more questions, please? Oh, you please, lady. My name is Anastasia. I'm the chief architect of the first architectural design group. So we are now making repairment of oncological inpatients department in the city of Kazan. Today, a lot is spoken about healthcare design. It means that the surveys are carried out in accordance with different standards. On the other hand, a lot of repairment is fulfilled not only, only from the outside. So the facades are repaired, and no one ever thinks which is inside. So the building is beautiful, and some experts think that it is enough. But people go inside and they sense something, they feel something. Do you think it is important? Do you work in collaboration with architects concerning the impact of noise, of sound, of color to the human health, to the interior status of the human body? Thank you very much, and thank you for your very interesting question. This year, we fulfilled several projects here in Moscow, and one of them is the opportunity of Muscovites to vote digitally for some ideas. So we do not only try to construct healthy ecosystem, we try to consult Muscovites using the platform Active Citizen, Активный гражданин. There was a special service for designers and architects. The target was to work out an image of a new Moscow outpatients department. That project included color, design, everything which is responsible for high spirits of the patients who enter those outpatients clinics. We've had a competition. 10 projects were chosen. They are all included in the so-called brand books. We now refer to all the construction bureaus which construct and improve Moscow outpatients clinic. This is what we have in outpatients clinics of Moscow now. Dear colleagues, we are finishing, but we have time for one question, please. Sergei Petrikov, Sklifosovsky Institute. We're speaking a lot about patient-centered. But all these measures and events require a lot of effort from the medical staff. In the United States of America, there is a campus system of inpatients department development. They are kind of big complexes, or when the people who work there can have a kindergarten there so that they needn't go somewhere to leave their kids. Do you think this kind of campus system is possible here, providing our legal acts and regulatory acts? Oh, thank you very much. Moscow International Medical Cluster is a good example, and it is now being developed on the basis of this kind of campus system. In Moscow, we have big inpatients department, which is being constructed there. In Kommunarka, which is a huge territory, this big hospital is being constructed now. It will have departments for infectious diseases, for oncology. It will be a multi-profile hospital. Probably it's a good idea to think about this approach there. Dear colleagues, I would like to thank you once again. We are in for the plenary, but before we go away, please, could you think about the future? Tell me, please, in one sentence, what is impossible in a healthy city of future? Could each of you give an answer of one word? So what is impossible in a healthy city? I think it's impossible to be unhappy in such a great city, because there is every opportunity for everyone to be happy. It is impossible not to think about your health, so you just couldn't deal without it. So you need to take care of your health. Maybe our guests, international guests, what is impossible in a healthy city?
Possible not to experience stress as an urban dweller. That means we have to do something about increasing stress levels that are health relevant. And as I explained earlier, it's all about social stress. And this is something which we have to focus on in public mental health strategies for our urban environments.
Thank you. Спасибо. Прошу.
I think it will be impossible not to enjoy public spaces and to enjoy those spaces with our families, our friends, and our loved ones.
Спасибо большое.
And I think it would be impossible not to take account of the range of opportunities and costs of certain public policies. So I think making those choices, it's a necessity. So I think it would be impossible to avoid them.
Thank you very much. Анна Юрьевна, ваше слово. Что не...
Thank you very much. Now, what do you think is impossible in a healthy city? Well, if it's a healthy city, it is impossible to be ill. This is our target, and we need to create such a city where all people are wealthy and healthy. So we need to do our best for that. Well, I agree with my colleagues. Absolutely, yes. So be wealthy, be healthy in big, healthy, wealthy cities. See you the plenary session.